Hey everyone, welcome to Toolkit Talks. My name is Jennifer Smith and I am a public health resilience coordinator as well as an e-learning developer, and I'm with Colorado Department of Public Health and Environment along with CoCares, which is the Colorado Alliance for Resilient and Equitable Systems, and the Office of Public Health Practice, Planning, and Local Partnerships. And today's Toolkit Talks is the succession planning for local health departments, and this is video 1 of 3. Thank you so much for joining us. So this toolkit was a collaboration between Ohio State University Center for Public Health Practice in partnership with the National Association of County and City Health Officials, otherwise known as NACHO. And this toolkit is for specifically public health, and we are kind of making it for public health in Colorado, but honestly, I think everyone could benefit from succession planning. So a lot of the tips and tools and information in this toolkit can be utilized by anyone needing to make sure that they have a good succession planning in practice. So the video structure today, we're doing this in 3 videos. Today's video is the first video, and it's an introduction to succession planning and making the case for it. Why are we doing this? Video 2 will be going over the steps and phases of succession planning, and then video 3 is the implementation, evaluation, and then ensuring success. So here is a QR code to get and download the toolkit. The toolkit is found on NACHO's website. You do have to sign up and get an account, but I think it's really beneficial. They have a lot of great information, a lot of great toolkits that have come out of NACHO. And it's called the Succession Planning for Local Health Departments, Ensuring Talent Sustainability for Optimal Public Health Outcomes. It's actually part of a course that they have, which is pretty much exactly like the toolkit or guidebook as they call it. But along with that, when you sign up, if you want to take their course, you can, or you can just download the guidebook. And then also, of course, follow along with our video series, which we do recommend kind of having that and reviewed it before doing the videos, just so you have a little more understanding. So our objectives today for this first video is 1, define succession planning. You know, what does that mean? 2, describe the importance of having a succession plan. 3, differentiating between replacement planning and succession planning. 4, describing the business case. So that includes organization, employee, and client benefits, workforce statistics that drive the need for succession planning, and processes and counterparts that correlate with the succession planning process. So let's get started. So succession planning can and should be a process consciously and thoughtfully approached throughout the employee life cycle. This will ensure knowledge is successfully transferred between mission-critical individuals and leadership roles are continually manned. This process should take place well before a leader or mission-critical individual transition takes place. And the aim is to ensure the continued high-quality delivery of public health services. What we don't want is people leaving, especially in those important roles, which they define as mission-critical roles, and then leadership roles. We want to make sure that nothing is missed when people leave and then a new person comes on. We want to make sure that we have a process in place for making sure all that information goes to the next person that takes that role. So they have an important distinction here between the terms. So we're talking about succession planning, but then you can see how workforce planning overlaps that, and they work hand in hand. But to have a good succession planning is very important. Succession planning complements your workforce planning, but it's not the same thing. Succession planning is not simply identifying someone with promotion potential to fill a vacant position when it occurs. That's more workforce planning, right? Succession planning is a process that ensures 2 things. 1, organizational talent needs are identified and aligned with strategy and objectives. And then 2, key positions are identified and a pipeline of new leaders is developed. Succession planning. It identifies leadership, it identifies mission-critical roles, it determines the knowledge, skills, abilities, and competencies required for new roles, It takes into account data and trends that affect turnover and retention. It provides a development program for identified talent. And it gives you an aptitude to grasp the new information and knowledge required to fill those roles. So replacement planning, which is kind of what we do on the norm when we're not succession planning, it identifies those short-term, long-term, and emergency backups. And it puts people in place who have a base skill set but are not developed to understand and transition into the new responsibilities. So why is succession planning important to public health in Colorado? So there was a Public Health Workforce Interest and Needs Survey, or the PHWINS, put out in 2017. It showed that health departments are facing a high rate of turnover, which threatens the sustainability of the workforce. The 2017 Public Health Workforce Interest and Needs Survey, or PHWINS, shows that nearly half of the public health workforce is considering leaving their organization in the next 5 years. Since 2014, there has been a 41% increase in those planning to leave. And again, this was in 2017, so it was before the 2020 pandemic. We know that a lot of public health employees left. We know that a lot of employees left for just different reasons in many different organizations, not just public health. But public health specifically, our numbers have gone down a lot. So we need to make sure that we're, increasing the numbers of people who are staying and developing our workforce appropriately. So more from the Public Health WINS survey. They kind of did the top 5 reasons for leaving. Why are people leaving? So these top 5 were inadequate pay, lack of advancement, workplace environment, job satisfaction, and lack of support. And I think what what succession planning can do, as well as workforce development, it can increase all of this, right? So people are maybe more satisfied in their jobs because they're getting development and training. People are really caring about them and their employment. They're getting more support. There's opportunities for advancement. Maybe the pay can increase because they're getting development and training. And then the environment, the overall workplace environment, is better. So again, for succession planning, while all employees will benefit, not all will be identified as an active participant. I think everyone's going to benefit from the workforce development and training that it can offer. Maybe they're not going to be identified as an active participant for certain roles, but I think they'll overall be very happy with just the development opportunities. Succession planning does involve significant time and effort, but it's an investment in your agency's future, and so you have to look at the cost involved in not having a succession plan. So ask these questions about your organization. How much does it cost to hire a replacement for a key position? What is the cost of lost productivity? How do these costs and losses affect your remaining employees? And how much time will it take to fill the position? So these are great questions when you're just developing your succession plan, but it will also show you how much really costs when we're having to constantly hire replacements and lose that productivity in a role because nobody's in it, and how it's affecting your remaining employees who may have to work harder and do different things because there's nobody in a certain role. So what is the business case for succession planning? Succession planning is smart business planning. It allows you to proactively develop people rather than simply naming them as replacements. And your organization, so we'll go through some of the benefits here. Organizational benefits: it stabilizes performance, it ensures continuity of leadership, it develops a pipeline of skilled workers, it minimizes disruption during change, it enhances knowledge transfer, it makes you the employer of choice and it can get you the better workers. It definitely helps with employee engagement, loyalty, and commitment, provides structure for development and training. There's reduced costs, and it helps ensure long-term health, growth, and stability of the organization. And the employee benefits, which again, there's a very short list here, but I think a lot of them cross over, as we can see from the organizational benefits. There's improved communication and morale amongst your employees. There's improved effectiveness because they've been trained really well. There's personal and professional development paths that you have. So these are great because they're going to want to advance in their role, or they're not, or they're going to want to maybe move into different roles, and that way you'll know and you understand where they want to go. And then of course community and partner benefits, also stakeholder benefits. There's improved reliability. Your staff is so trained and just know exactly what they're doing. Improved staff knowledge, more efficient services, which is always beneficial for everyone. Increased staff responsibilities and more pride in their work, and that will really show to those community members and to the stakeholders and partners. So there's 4 key processes that feed into and out of succession planning that we'll kind of get into during these videos. The organization's strategic plan, the choice to pursue public health accreditation, the public health core competencies, and your organization's workforce data. And they have this graphic here that shows a visual of how that succession planning really does relate to other processes that you're most likely already doing, and will just feed into and out of all of those. So you have that accreditation process if you're doing that, your strategic plan, which everyone is doing, core competencies, and then your workforce data. So all of this is just feeding in and out of succession plan, and will not only help you develop succession planning, but it will also help you in on all 4 of those other processes that you're already doing. So we'll start with strategic planning. It provides criteria for monitoring progress and outcomes, provides a clear picture of where it is headed, what it plans to achieve, and how, and measures to monitor progress. It's grounded in decisions the organization has made about strategic priorities for the near future. And it's based on the priorities. It provides a basis for future decision making. And it's fundamental to effective management. So here's just a little example. They went a little further in detail in the toolkit that you'll see. But one example of how succession planning fits into the strategic plan. So there was a health department that decided to focus more on financial performance in the future. For program manager jobs, there's an expectation now that they participate in the budgeting. So any potential successors will need to have training on budget and participate in financial reviews and work on the budgeting teams as part of their development plan. So you can see that adding this into the strategic plan sort of gave this new information, a new part of the job to any program manager. So somebody who wants to be a program manager will need to participate and get training on budgeting and financial aspects. So this is a great example. So another part was core competencies. Succession planning doesn't start with people, it starts with the requirements of the position. The 8 domains reflect skill areas within public health. So there's 8 domains in the core competencies. And then there's 3 tiers that represent career levels for public health professionals. So I would definitely learn about the core competencies for public health professionals if you have not already. You can use that QR code there to learn more and kind of check that out as a little side learning. But I would definitely work on developing those core competencies and learning them, because again, it's going to be something that people in these different positions are going to need to know. And then your workforce data. So there's all these areas that you can work on and these indicators. So like some of the indicators are developing key leadership skills, supporting organizational performance, creating a formal training structure. So you can use the core competencies for public health professionals as key performance indicators. And then key leadership skills should be determined and talent gaps identified through competency assessment of these skills. And those can be your data points, right? And so you're going to support organizational performance by aligning with prioritized strategic areas and organizational performance metrics. A workforce development plan, such as those required for the Public Health Accreditation Board, or PHAB, is an effective way to regularly assess skills, and it provides a formal structure and accountability, and we'll get more into that here in just a second. So you can see how all your workforce data will also come into play when you're doing your succession planning. So again, you can align your succession plan with the PHAB standards and measures. If you're looking to get that accreditation, this is a great way to help with that. And so they just give you a couple examples here. Standard 8.1 is to encourage the development of a sufficient number of qualified public health workers. Standard 8.2 is ensuring a competent workforces through the assessment of staff competencies, the provision of individual training and professional development, and the provision of a supportive work environment, which is exactly what you're doing with succession planning. So I would check the PHAB website out. There's a QR code there if you want to take a look at that and just kind of get to know the standards and measures. And so really what we're doing in succession planning, I feel, is supporting our staff. Since one of an organization's largest investments is in its people, as fiduciary stewards, we must ensure all people-related plans and decisions support this investment. Planning for talent is one of the most impactful ways to do just that. Thank you so much for watching our presentation. I hope that you enjoyed this first video. Again, I would make sure that you are downloading the toolkit from NACCHO or the Succession Planning Guidebook, doing the course there if you prefer to do that, and then coming back and watching the videos so that it makes a little more sense and you have that kind of prerequisite knowledge. Look into all the extras that we put in here, you know, the PHAB, the core competencies, make sure you have a good understanding of that, and then we hope to see you at our second video, which will get a little more in depth into succession planning. Again, connect with us through the QR code on here. You can email us at ophp@state.co.us, and then also check out our Who Works in a Local Public Health Agency training that we put on cotrain.org. The course ID is 1121182. It's a really great course just to get to familiarize yourself with different public health job descriptions and job titles. So it's a really great course, and it goes along, I think, really well with succession planning and as well as the core competencies. So I appreciate you being here today. Thank you so much, and have a good day. Bye.